I'm here today with Dr. Vernon Williams, who is quite impressive. He has the Wellness and Aesthetics Clinic in it's San Antonio, Texas, right?
That is correct.
Correct. I love speaking with doctors such as Dr. Williams, who have stepped out of the standard of care box. He's so highly educated, which I'll tell you about in a moment, but imagine for any of you who went to medical school all those years and then to go back again years later to relearn a new form and to adapt to the changing planet. And that's what he has done. And that is the purpose of foreverhealth.com. For any of you watching right now, foreverhealth.com was put together to gather the doctors who understand the effects of the environment, the planetary changes, how medicine has changed, and how we can age a new way without drugs unless absolutely necessary. So hello, Dr. Williams. So nice to talk to you.
It's my pleasure to talk to you, Suzanne.
Thank you. I want to read your statement about your practice because I was really impressed. Dr. Williams says, I believe you can turn back the clock. We can make you look, feel, and function like a younger you. Who doesn't want that? I want to reduce your stress, eliminate your pain, and allow you to live a healthier, happier life. I want you to be like me, 29, again and again. So when you're ready to experience the younger, healthier, happier you, we will be waiting. We will treat you like royalty as we fulfill your desires to turn back the clock. Well, I mean, who doesn't want that? At what point in your medical career, and I see that you went to Harvard, you went to Einstein Medical School, your credits are unbelievably impressive. At what point did you decide you wanted to expand and take into consideration the planetary changes?
Well, back in the early 90s, I was gaining weight.
Mm-hmm.
My breast was enlarged,
mm-hmm.
and I did not have any sexual desire. And I went to see a doctor, and he said that I had a pituitary tumor. And I had a pituitary adenoma, it turned out to be. And so they told me I'd have to take medication for the rest of my life. And for the first time in my life, I was a patient. I was always the one on the other end, and not someone was a patient. And so that's what started me on this road. It took about 15 years before I finally understood what was going on, and I decided I needed to make a change because my endocrinologist that I had was not helping me. I continued to gain weight, and it was affecting my lifestyle, and so that's when I started looking around.
And so what do you think has happened? Why people are so unhealthy? And even from the youngest to the oldest, everybody's complaining. I find mostly about the gut and not sleeping and no sex drive. What has caused this?
Well, as we live life, it's the environment, it's the foods we eat, the toxicities, it's how our body responds to all these things. And unfortunately, in medicine, we learn how to prescribe pills for everything. We don't really treat patients' problems. Everything requires a pill, and if there's no pill for the problem, it's not a problem according to the medical society.
Right. Well, I remember in one of my interviews for one of my books, I asked a doctor, how did it get this way? And he said, well, around the turn of the century, there was a guy by the name of Abraham Flexner who was hired by the two richest families in America, the Carnegies and the Rockefellers, who owned pharmaceutical companies. And they sent Flexner around to the Institutes of Higher Learning, Johns Hopkins, First Presbyterian, etc., to teach allopathic medicine in perpetuity. And that's how all the pathics got phased out or considered wacky, naturopathic and chiropractic. And so for those of you who are so highly educated like yourself, to create this new specialty, do you take a lot of flack from your peers?
Of course. In San Antonio, I'm the crazy doctor that's always CMEs. It's amazing. Normally in medicine, in Texas, you only need 24 CMEs every 2 years.
Really?
And I do literally 200 to 300 CMEs a year. And so I'm always off to a new conference because I feel like if I'm not in a conference, I'm falling behind because there's always something new coming on. You know, it says doctor in training for a reason. You know,
right.
you don't
What, for the sake of our viewers, give me the explanation of the initial CME.
CME, continuing medical education.
There you go.
And
Okay.
so doctors are supposed to do so much continuing medical education. Before I became the new doctor that I am now, traditionally you'd wait till the last minute and then you'd search the internet and find some course in some vacation area, and you try to squeeze a few hours in to get your hours that you need. And
right.
That's what most doctors do now.
Well, I see when I look at what you offer at your wellness center, you have such an understanding of hormones and hormone replacement. And so today what we're going to talk about is diminished sex drive, because I hear this from both men and women, not as much from men. Whenever I mention the word testosterone to a man, I'm sure you hear this all the time, they say, oh, I don't have any problem in that area. And so what do you say when a man comes in who says, I don't know, doc, I'm not sleeping well, and I don't seem to, have the sexual drive I used to have. What do you say to him?
Well, the funny thing about men is they're always great. There's never a problem. And, we all start with blood work and we check everything out. Mm-hmm. And invariably, most men are low. The sad thing about the way things work out is they give you normal values for your age. Unfortunately, if you're 50 years old, you may not want to have the normal values of a 50-year-old.
Right.
Because that's where you are. You'd rather have the normal values of a 29-year-old. And so we talk about how to optimize things with the guy. And with the guys, we have pretty frank conversation. They tell me this and I laugh. And I say, come on, it's me. Don't tell me I don't already know, and so we talk in general, and we're pretty open here, at one point, I used to say that we had a age management clinic, and we were about getting people healthy. But now I'm proud to say we have a sex clinic, because sick people don't want sex, but healthy people want sex, and healthier, the more sex you want.
I always say, what's the last thing you feel like doing when you're not well and you don't have any energy? The last thing you feel like doing is having sex. So when a man or a woman comes in, and you can probably, with your questions, determine real early on what's going on with them. Do you put them on hormone replacement right away, or do you do a blood test to see where their deficiencies are? Do you low dose them and then wait for them to complain with symptoms or lack of?
No, actually in our clinic, my patients do not see me before they fill out a 27-page history form.
Great.
And then they get a standard blood panel that I do. And so they get the blood work, and they get the history form, and then they come in, and we have some in-house testing that we do, like an HRV, heart rate variable testing. We do an in-body, we do a minerals test, we do toxic metals test, and so we do all these tests before they come to see me. When they come into my office, we sit down for 2 hours. That person and I, we talk, we go over their history, we go over their blood work, we go over the in-house testing, and then we spend some time going over the problems that we find in there. And so when they're done 2 hours, 2.5 hours, they feel like they've been blown away because they've never heard any such thing from the doctors before.
And for the sake of people who are watching this, how incredible to get that kind of hands-on treatment from a doctor. It just doesn't happen in regular standard of care. What is it now, especially with the affordable care? Don't they get like 6 minutes or 8 minutes?
Yes.
Go on.
I say there's two types of doctors. Mm-hmm. There's a doctor that wants to do as little as possible for as many patients as possible, or the doctor that wants to do as much as possible for as few patients as possible. And that's the one I choose to be, because we see about 4 to 5 patients a day, maybe 2 to 3 new patients a day. That's about it. And we spend a lot of time going through everything, because that's very important that we understand each other and that we know what's going on before we even start treatment.
You know, I have a friend who's a doctor in Toronto, Canada, and he said he sees 70 patients a day. And I said, how can anybody see 70 patients a day? I said, what do you say to your patients? And he said, I usually tell them it's going around. But this is the beauty of this kind of medicine. For those of you watching and listening, with a Dr. Vernon, who's going to give you 2 hours or thereabouts of his time, who's going to thoroughly test you. I heard you mention mineral and nutritional deficiencies. That's such a big thing, isn't it?
Oh, yes, definitely. You know, minerals, everything you do causes problems. You know, if I was to take some dirt in my hand and swallow it will pass right through me into my stool, because that would be considered inorganic minerals. Mm-hmm. And for those of you listening, minerals are whatever is on the periodic table. But then if an apple tree takes that same soil and puts it into the apple, the calcium or the magnesium or the phosphorus into the apple, and you eat it, now it's absorbed into your body. You see, if it comes from a source which has been alive, either a plant or an animal, it's organic and it's easily absorbed by our bodies as opposed to inorganic. So it's very important where you get your minerals from and how you do that.
And do you find people in general today are minerally deficient, particular magnesium?
Oh, definitely. Most patients are minerally deficient because, you know, our soils is not as rich as it used to be. And so if you get a fruit from 1950, it would have a lot more nutritional value than a fruit from today.
Right, right. Recently, where I live, there was a young boy on the playing field who dropped dead of a heart attack, sudden heart attack. And I have heard, and maybe you can confirm, I had heard that a perfect storm of low magnesium, high intake of processed food, chemicals, and heavy exertion all at one time can cause a sudden heart attack on a playing field. Have you ever heard of that?
Yes, most definitely can. Mm-hmm.
So would that mean if children are eating a diet of processed food that they should be on magnesium replacement?
You know, processed food is low in mineral content. And I think that in general, even if you eat a regular diet, you really do need some additional supplements to supplement it, because we just do not get enough minerals and vitamins in the foods that we eat.
Yeah.
And
go on. Go on.
No, you go ahead.
We're both too polite. I was going to say, let's get back to sexuality. When people are, their symptoms are clearly hormonal imbalance, and that's where the lack of sexual desire comes from. Is it a full program that you give them? Do you after, because you have all their blood work done, do you administer cream, or are they injections, or how does a person take bioidentical hormone replacement? Bioidentical hormone replacement, for the viewer, are biologically identical to the human hormone, an exact replica of what you once made or still make a little of. It's the natural hormones. I'm sorry, so go on.
No problem. Couple things. Number one, when I do see someone, I give them an executive health evaluation, which is a 6-7 page report going through everything that we talked about, and it indicates on there what they need to do to optimize each hormone or each problem that they have. All right. Then, as far as testosterone is concerned, I find that testosterone as an injection or pellet works a lot better than the creams.
Because of absorption?
Yes.
Because of absorption?
Because of absorption. You know, when you take some estrogen and you put it on your, or some testosterone, you put it on your hand. You know, if you rub it in for 10 seconds today and 2 minutes tomorrow more will absorb than today. If you rub it in a small area as opposed to a large area, more will be absorbed in a large area than a small area. Then what do you do with the finger that you just rubbed it in? You wash it off. When you wash off, you wash off some of the hormones. So every day that you take the topical, you are giving yourself a different dose of each and every single day. So it's hard to keep track of things like that.
So that's why a person can start on hormone replacement and be feeling good, and then after a while they come back and say, I don't know if it's working. It's because of an absorption problem?
An absorption problem. But the other thing with when you do topical hormones, if you have kids or pets, or your spouse, they can get it on your spouse. So I find that topical creams does not work as well. And you know, 4 years ago, when I used to use topical creams on women, the patients didn't really stick around. The females, they would come and they would go, and they wouldn't be loyal. But once I started doing pellets, things completely changed. 4 years ago, 75% of my testosterone patients were male. Today, 75% of my testosterone patients are women. And that's because of pellets. And women talk and men don't. And so women, when they feel good, they spread the word. And men, it's all me, baby.
Well, I've always worried about that with using hormone creams. You know, it may be okay, some of my testosterone rubs off on my husband, but I worry about my estrogen rubbing off on my husband because that can raise his DHT, which is dangerous, isn't it?
That's correct. And, you know, DHT can cause problems with your hair and everything else. So it's not a good idea to do that.
Right. I also once put my hormone creams on and picked up my cat. My poor cat, who's been fixed, was in heat for about a week, and there was nothing I could do for her. I felt so badly. So it shows you that the creams are very potent, but it's interesting that you're choosing pellets and injections. But there are a lot of people who say, is it natural to replace hormones? I mean, is it nature smarter than that when we run out, we're supposed to run out?
Well, you know, the way life works, you know, your hormones are optimal up until about 35. After about 35, nature says you really shouldn't have any more children because there's a problem that you may have Down syndrome or you may have a deformed child. And nature says you shouldn't. And so your hormone level starts dropping. If you know, and I tell my female patients, you know, if you want to stay young and attractive and vibrant and sexy, you need to optimize your estrogen and progesterone. If you're not interested in any of that stuff, by all means, don't even bother with it. And, you know, and testosterone, you know, that's your energy, that's your life. And, you know, for the men, our goal is always to make you 29 again, as well as the women. So our goal is to get their levels, all their hormones level, back to the way they were when they were 29, 30 years old. And that's what we always do with these patients.
So what you're essentially doing is restoring quality of life.
That is correct. And we use bioidentical hormones, which is different from synthetic. You see, when you put synthetic hormones into your body says, what is this? I have never seen it before. I don't know if it's good for me or bad for me. Should I attack it? Should I destroy it? Should I stick my immune system after it? Your body doesn't know. When you give bioidentical, your body thinks you made it. It thinks it's been making it all your life. There's no difference from it. And that's how your body works with bioidentical. So bioidentical is far superior to synthetic hormones.
Well, the two questions that I always hear from people is, and you can answer these, women will say to me, but these are menopausal women on hormone replacement. will I get pregnant again? Can you answer that?
Well, on women who are postmenopausal, the key is this. You got to make sure that you optimize. And optimize means that you don't give them too much or too little. So someone who is postmenopausal, who still have a uterus, if you give her too much estrogen, she suddenly can have a little period. And so you have to be a little cognizant of that, because no 60-year-old want to have a period. So you have to be careful how you do it to make sure you give it the right amount. And certainly you need to know what happens, how to take care of the problem if you do that, because every once in a while it will happen.
Right. And the other question that I hear from women and men is, I'm afraid of taking hormone replacement, the bioidentical hormone replacement, because I don't want to get cancer. Can you answer that question?
Well,
statement?
Yeah, I always say to people is this, when is your hormones the highest? And they usually say about 20, 25. I said, did you have cancer at that time? Well, if we give you bioidentical hormone, then you shouldn't get cancer, because 20-year-olds don't normally get cancer from your hormones. It's just like saying giving you too much testosterone will give you prostate cancer. No, it doesn't. I mean, it's just put you back into a healthier state than you used to, than you are now. But bioidentical hormone in general does not cause it. Yes, we do understand that some women who have breast cancer, we have to be careful with their estrogen administration and stuff like that, because there's some estrogen which can go down the cancer pathway and cause problems. So you got to be looking at all those things.
And how do you feel about human growth hormone?
Well, I think growth hormone is just like any other hormone. I call it your body's healing hormone. And basically, when your growth hormone is not optimal and you have an injury, it tells your body, let's fix the problem next month. If it's optimal, it says fix the problem now. So if you're going to have surgery and your growth hormone is optimal, your doctor is going to say to you, boy, you recovered in 2 weeks. Everyone else takes a month to recover, because growth hormone helps you do better. That's why athletes want growth hormone, because they have a lot of injuries on the field and they want to get back on the field, and growth hormone, your body's healing hormone, helps you fix things quicker.
Yeah, I always feel, athletes get a bad rap who take testosterone or human growth hormone. I feel it's so misunderstood because, and maybe you can agree or not agree with me on this, stress blunts hormone productions. Athletes are performing at such a high level that they're going to blunt out before the average person. So how do you feel about athletes who are requiring testosterone and not being able to take advantage because of athletic rules?
I think that's wrong. Our goal is always to be the healthiest we can.
Right.
Athletes spend a lot of time in the gym trying to build muscles, trying to make the craft better. It's just like a physician who spends a lot of time in his books trying to get his craft down together. That's what athletes are doing. And if optimizing the testosterone will help them perform better, I think they should be allowed to do that. I mean, testosterone, we're talking about optimization. We're not talking about excessive amount. We're talking about getting where your body performs the best. And I think it's a shame that we don't allow athletes to use all the tools that's available to them to number one, optimize their craft, and then the entertainers to be able to entertain us appropriately.
Particularly when you are so diligent and you're doing blood work and you see where the levels are, and it's like filling the tank, isn't it? If your levels are down, you put back and now you're even again. I think it's very misunderstood in many arenas, and that's why this kind of medicine excites me so much, and that's why doctors such as yourself excite me, because you do put yourself out there on the line. Because I find a lot of doctors are down on what they're not up on. And so here you are doing something they don't know, and so you've got to be irritating to them at times.
Well, a big problem with physicians is that most physicians get their education from the drug companies.
Yes.
I mean, that's where they get the education.
Right.
The only way a physician knows about a new drug is because the drug rep comes and tells all the wonderful thing about this drug. He's not getting the other side saying how bad it is. He just gets someone saying, this is a great drug, you need to try it. And I used to be an ear doctor. I see lots of people, try this new antibiotic, try that, and we'll try it. And oh, great, we get samples. And so doctors are educated by the drug company, so therefore they only prescribe what they know.
Yeah.
Unfortunately, natural stuff is not, it's not FDA approved. And because of that, they don't get a drug rep come and say to you, try vitamin C,
Right.
And that's the problem. So they don't know.
Right. Well, as someone who has been replacing my hormones with bioidentical hormones for close to 25 years now, it's had a remarkable effect on my aging and my vitality and energy and sexuality. We got a couple more minutes left here. Tell me, does a lack of a sex drive have to be a life sentence?
It does not. This is one of the problems, in sexual health. Females, there's lots of stuff out there for men, but females have a problem because there's nothing out there for females. Most females have, well, I shouldn't say most females, but a lot of females do have problems with desire.
Right.
They have problems with arousal. They have problems with orgasm, and they may have problems with pain, dyspareunia. And so, unfortunately, most females don't talk to their doctors about it. Only about 10% of women actually share these things with the doctor. And therefore, they go soundly unchecked. And a lot of these problems are not even recognized until they cause a problem in this female's relationships. So I would say there's good 50 to 60% of women that have some kind of female sexual dysfunction that is not being addressed by physicians.
Are they faking it?
No, they actually do have problems.
No. I mean, are they faking that they're in the mood so that they can try to keep their marriages together?
I think a lot of women do that because it's not accepted to say, I don't have any desire. I mean, if you're married to a woman and she says, I don't have any desire, right away the guy feels like, what did I do wrong? Someone's wrong. And so they don't tell us. They don't tell their doctors. They don't tell us. And and even if they did tell most physicians can't really help them because they don't know what to do.
Right. Right. Well, I think you're doing a great service, and all your information is so impressive. He not only offers everything that we're talking about, a complete understanding of all of the hormones. We didn't even get to talk about the thyroid hormone, which I know you could probably talk about the thyroid for an hour. But if you are looking for a new kind of doctor, and we're talking qualified medical doctors who are highly educated, who have stepped out of the standard of care box, who are treating in a new way. Dr. Williams is one of those doctors. So go to foreverhealth.com. And I want to thank you so much. I also see there you're with the Air Force. I want to thank you for your service. And I appreciate the kind of medicine that you're practicing. I know what you had to go through to get to this place. And congratulations.
Thank you so much, Suzanne. I'm so happy that I'm part of Forever Health. I've been with you since the very beginning, and it's been a very, very good relationship.
I'm so glad. Thank you very much. Thank you very much.